Guided surgery perfects your way of working with a simple, safe, and accurate standardized procedure. Together with the manager of our internal laboratory dedicated to planning guided surgeries, Betti, we will look at the kits and instruments, and we will study the steps of a guided surgical session.
Good morning, it's Betti here. I'm the responsible of guided surgery in Baby Dental. In the last 4 years, we have been developing a system that allows all our implants users to work in efficiently and fast way, saving time and money, but mostly be able to solve a lot of the requests of our clients. As we know today, helping and making patient happy is a positive marketing index, where it is your clients who find your next clients. But to succeed at this great enterprise, we absolutely must ensure that the patient leaves the dental studio with a smile on his face and looking forward to showing off his best smile with friends and relatives. So, today we are going to see one of the techniques that allows your dental studio to take a step towards the happiness of your clients. Guided surgery, as you surely know, is one of the most used methods in implant surgery. It allows to achieve a result that is very difficult or difficult to obtain with the traditional surgery, but mostly it allows you to help your client to overcome the fear of the surgery, not having to open the flap and not having to suture later, but above all to reach a flawless aesthetic result and the possibility to do the immediate loading. All of this could make your client happy, maybe. So this is our kit of drill that is used for guided surgery. It is a complete kit with everything you need for the surgery. You will not need anything else except the surgical guide. So let's start from the basic concept that distinguish all the drills that make up the surgical kit for guided surgery compared to the drills for the traditional surgery. Both drills having a working part that is the part that mills the bone and create the osteotomy. The basic difference is the neck present only in the guided surgery drills. This neck safely and very accurately guides the drills into the sleeve, creating an osteotomy with length and inclination predetermined in the planning phase. So our surgical kit for guided surgery is composed as follows. In the lower left part of the kit, we find the starting drills, punch to remove the gingiva from the bone, leveler to prepare the site of the implant, and lance drill to make an osteotomy on the cortical bone. Immediately below, we find the keys for prosthetic screw, the extractor and the converter. The converter is used to transform the drills with the neck 4.2 in drills 5.5 millimeters for the big sleeve. Further up, we find the tools for multi-unit abutment, the key for straight multi-units, the positioner for inclined MUA, and the bone mill. On the top left, we find that the tools that we could consider the second step for the guided surgery. That is the component for fixing the surgical guide, such as crystal pins for small sleeve and for big sleeve, and the lateral pins, the drill for lateral pins and the lateral pins. In the center, we find instead the depth drill with a different length from 8 millimeter to 14 millimeters and different diameter starting from 2.1, that is the pilot drill, to 5 millimeters, divvy up by colors. On the top of the center, we find the compactors. The compactors is very important for the preparation in legs compact bone, such as in upper jaw, and it's possible in many cases to replace the drills with the compactors to compact the bone before inserting the implant, thus creating better primary stability. In the lower, always in the center, we find the countersink drills that are used for the preparation in case of hard bone, such as in case of surgery in the lower jaw. Moving instead in the right part of the kit, we find the mounters, standard mounters, okay, and mounters +2 and +4, that we can use it if we need to remove the sleeve in collision with the gun. We have to use mounters +2 or +4 according to the position of the sleeve. Immediately below, on the right, we find the drivers and the extractor for mounters, together with the keys for direct insertion of the implants, for normal connection, standard connection, 3P, EVU and wide, and for slim connection. If we remove the cutter holder, in the lower part of the surgical kit, we find the straight manual key and the ratchet, fixed ratchet and dynamometric ratchet. Okay, now, after seeing how the kit is composed, we're going to see how to use all the tools into the surgical kit. Here we prepared a little box with 2 implants, 4 by 10 and 4.5 by 10, an half mandibular and an half surgical template. Here in this box we prepared 2 multi-units abutment and 2 temporary abutments, and the temporary to do the immediate loading after the surgery. So now I have to prepare the site for the surgery. I have to prepare my patient to the surgery. Okay. Okay. Okay, now my patient is ready to do the surgery. Here we have the half mandibula and the half surgical template. Two different sleeve, the small one, the 4.2 millimeters, 5.5 millimeter, the bigger one, and the sleeve for lateral pin. Now here we don't have the gingiva, so in this case we're starting the surgery directly with the fixing tools, in this case with the lateral pins. So we're going to perform the osteotomy with the drill for lateral pin. Now, first thing, important, very important thing, we have to find the proper position of the surgical guide. Then we have to insert the drill, okay, into the sleeve. All the components must be pushed along the guide until the stop on the sleeve. So one of the most important thing is to insert the drill into the sleeve and make sure that the drill is guided into the sleeve. Okay, if the drill is not guided into the drill, you can make an osteotomy, a wrong osteotomy. So insert the drill, okay, into the sleeve, and we start with the drilling, okay, until the stop on the sleeve. Now, after the osteotomy, we put the lateral pin into the sleeve. Okay. Okay. Until the stop on the sleeve. Okay, the camera don't make focus. Okay, perfect. After the preparation for lateral pin, we can begin the surgery from the starching drill, leveler and lance drill, for both sleeve 4.2 and 5.5 millimeters. So first 4.2, and then using the converter we can make an osteotomy on into the sleeve 5.5 millimeters. Okay, converter. Okay, perfect. And then the lance drill. Okay. Okay. Now we start with the depth drill until 8 millimeter. So here we have two implant 10 millimeter length. So we start with from 2.1, then 2.1 by 10, then 3 by 10, after 3.5 by 10, and last drill 4 by 10 millimeters. Okay. 8, 2.1, 2.1, 8 millimeters. Okay. Okay. When the drill is already into the sleeve, we can perform the osteotomy. Okay. First drill. 10 mm length. Okay. Perfect. 3 by 10. Okay. 3.5 by 10. And last drill, 4 by 10. Okay. Now we have already done the first osteotomy for implant 4 by 10. Now we have two ways. Insert the first implant or make the surgery even on the second implant. Now we're going to do the surgery on the second implant. Okay, so we start always on from pilot drill 8 by 20.1 by 8. In this case, we need to insert into the sleeve the converter to transform the drill with neck 4.2 mm in drill 5.5 mm. Okay. 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 We remove the converter. We take the implant 2.1 by 10 and we put on the converter. Okay. Okay. Now 3 by 10. Okay. We use the kit. We increase the length before, and then we can increase the diameter of the osteotomy. Okay. Now drill 3 by 10. Okay. And now 3.5 by 10. We put on the converter and okay. Okay. Now 4 by 10. Okay. And now the last drill, 4.5 by 10. In this case, we will not use the converter because drill 4.5 has already the proper neck, the neck 5.5 millimeter. I think. Okay. Okay. even this osteotomy is done. Now we're going to insert the implants with the mounters. In this case, we don't have sleeve +2 or +4, so we're going to use just the standard mounter. We put on the implant the mounter with the driver screw. Okay. Okay. And with the driver mounters, we take the mounters, and with the ratchet, okay, we can extract the implant from the box. Now we're going to put the implant into the bone. Okay. What point we have to reach during the insertion of the implants by mounters? The mounters has on the top, okay, an hexagon. Okay, this hexagon we have to put in this hexagon, sorry, in matching with the hexagon of the sleeves. Okay, even for 4.2 and for 5.5 millimeters sleeve. When the mounter touch the sleeve, okay, we're going to stop and find the proper matching between mounter and sleeve. Okay, like in this case. Okay, the mounters is completely in matching with the hexagon of the sleeve. Okay, now we're going to put the second implant 4.5. Okay. If you want, you can take off even without the reach the implant from the box. Okay, screw a little bit into the sleeve. Okay, and then use the ratchet to insert the implant. Okay, perfect. Okay, now we have already inserted the both implants, okay, 4 by 10 and 4.5 by 10 with the mounters. Now we have to unscrew the mounters from the implants. Okay. We can remove the lateral pin and remove the surgical guide. Okay, both implants are going in the position planned in with the surgical kit, with the surgical software. Sorry. Okay. Now we we're going to put on the implant our multi-units abutment with the temporary abutment and with our temporary. Okay. By the key for straight MOA, I take the multi-unit, okay, with the key, and I'm going to put on the implant the multi-unit abutment. Okay, perfect. A second. Okay. Okay. Now I can put on the multi-unit the temporary abutment, and by the screw I join the multi-unit with the temporary abutment. Okay, even a second. Okay. Okay. Multi-unit, and the temporary abutment. And now I can put on the implant my temporary. Okay, perfect. Okay. Okay. Okay, now we have finished our surgery. Our patient is happy, I think. I don't know. But thank you for joining us and see you the next time. Bye.
Click on the link below and contact us for more information.